Welcome to today's session entitled Family Caregiving, New Horizons for Caring Across America. I would like to introduce John Feather, the CEO of Grantmakers and Aging and moderator for today's webinar. John?
Thank you, Stephanie. I'm delighted that so many of you have joined us today on this important topic. Before we begin, I want to thank the John A. Hartford Foundation, whose continuing support allows us to provide this webinar series free of charge to our audience. I also want to thank today's co-sponsors, Archstone Foundation and Grantmakers in Health. There are roughly 18 million family caregivers of older adults in the United States who provide the majority of long-term care services and supports to their loved ones. The varied and increasingly complex roles of family caregivers and the implications for social, health, and economic realities of families in question have brought family caregiving to the forefront of public policy. This webinar will discuss a recent National Academy of Sciences, Engineering, and Medicine report called Caring Across America, promising approaches and some ways that we can all help in having a role in this solution. We are really pleased today to have with us two influential and important voices in this field. Dr. Donna Benton, the director of the University of Southern California Family Caregiver Support Center, and Ronnie Snyder, the program director at the John A. Hartford Foundation in New York. Welcome to you both. Donna, let's begin with you. Please set the stage for us by sharing a general overview of the report and also the findings related to direct services and interventions.
Certainly. Thank you for that warm introduction. So to set the stage around the National Academy of Sciences report on Caring Across America, let me begin with the next slide, just to give you a little background of who I am. So if we could move to the next slide. So for the last 30 years here in California, we started 30 years ago with the Caregiver Resource Center system because there was a sense that caregivers were not being recognized for what they were doing and having some type of support. So 30 years ago, the whole mission for the Caregiver Resource Center was to really help families and communities master the challenges of caring for somebody with any type of brain impairing condition. And so it's really great to see that more over time we have more people interested in caregiving. Next slide. And part of that interest really has been because we've seen a phenomenal growth of caregivers in the United States. Just to look at some key findings, as a reminder, we have about 17.7 million family caregivers just to older adults, and about 8.5 of those caregivers are caring for somebody with what we would say are high needs. And that means that they're probably helping with dressing, bathing, helping somebody get in and out of bed. And if you look at if you were to pay all of the family caregivers, so these are the informal, unpaid caregivers that are the mothers and the daughters and spouses and siblings, if you were to pay them, say, even minimum wage, it was estimated that the economic value is over $470 billion a year for caregiving. So as you can see, not only is this an important issue because of it impacts so many people, but it's important for our whole overall economy. Next slide. So one of the things that I wanted to point out about our caregiving is that, if we think about who caregivers are, the Academy report really had 5 key objectives or 5 questions that they asked. And one was, what's the projected future health status and care services utilization of older Americans. So who's using our care? What's the best use of healthcare workforce? And where possible, how do we integrate these informal caregivers within the models that are helping in our healthcare delivery system? How should this healthcare workforce be educated and trained to really help older adults and the persons who are helping them? So, and can we finance it? What are the best ways of financing? What are some of the best ways to even recruit not just the informal caregiver, but how do we facilitate recruitment and retention of caregivers who are also paid to help our growing older adult population? And then the last question was, how can our public programs be improved to accomplish any of our goals around workforce and supporting caregiving? So this quote by Wendy Lusbader really, I think, sums up what we are looking at from this report, is that we really have to, as a society, work together to support both our caregivers who are paid and unpaid, and because they tend not to be recognized or even honored. So next slide, please. So just as a reminder, so that maybe we can all kind of think about when we're talking about these informal caregivers, caregiving is something that everyone probably will be doing at some point. Either they'll have a caregiver, you'll be a caregiver, you know a caregiver. But while there are a lot of rewards associated with caregiving, there are also some strains that have been reported through national studies of family caregivers. And so I put on here some statistics that I think are important to think about, because this does influence how we want to do and set up interventions and programs for our family caregivers. So some of the things that have come out of reports is that where caregivers are reporting 25% of caregivers really need to be lifted, so there's a lot of physical activity, which then often can result in muscle strain and back pain for the caregiver who's assisting someone. 16% of caregivers report that their own health has actually worsened since they have become a caregiver, many times related to the fact that they may not go to the get their own health checkup while they're trying to help coordinate health care for the person they're caring for. 46% of caregivers in multiple studies, this number ranges between like 30 to 46%, as high as 46%, have actually been found to be clinically depressed or have significant symptoms of depression. And so this is a very key mental health and public health issue. As you can see, caregivers are more likely to use prescription drugs for anxiety, depression, and insomnia. You don't get a lot of sleep sometimes when you're caring for someone. And when we have about half of the working population of caregivers who, I'm sorry, half of caregivers are also working. And of those, 80% really report a lot of emotional strain in trying to balance both their work life and their personal life. Next slide, please. The other thing that I want to point out around caregiving is that the caregivers themselves express a lot of things that happen as far as stress, in addition to the physical strains that are reported, so that you'll see that caregivers sometimes will feel that they're either trapped or caught in their caregiving situation because it was more of a tag, you're it, you're single, you're a woman, you were closest to mom, you're the spouse. So sometimes caregivers may feel that they don't have a choice, although they do want to do this for their relative. There's financial strains. People begin the caregiving experience thinking it's going to be something acute. It could be turns into a more long-term chronic issue, and currently, and this is one of the things we'll be discussing, that there aren't a lot of supports for the caregiver and sometimes even for the person they're caring for, so that there are financial strains that occur. You see people are taking on different roles where an adult child now feels as if they have to parent a, someone who may have dementia, or a spouse who is taking on the role that they're not used to in the relationship, where maybe before they had more help because of the within the marriage. You'll see some breakdown of the support network. After a while, friends and family members may fade away from the caregiver, and gives so that the caregiver really begins to feel very isolated and alone. The other thing is that caregivers feel that oftentimes that when the person, maybe initially or as the disease progresses, the caregiver doesn't feel that they have the skills or ability and aren't quite certain how to handle the changes that are occurring for the person they're caring for, both physically and emotionally, and so that they feel that they aren't doing enough. And so that's kind of part of the skills or the abilities. And of course, you're dealing with the disease itself, and if you don't understand what's going to be the course of the disease, will there be hope for a cure? At how long will the disease go? All of those things, and trying to understand about the disease. And then families, I don't know, from time to time, families can't agree on how to do things. The best way for mom to, how much money should be spent for mom's care? Are you doing enough? Is it time? Should mom be able to go to an assisted living? All of these type of things often reinitiate maybe earlier family conflicts. Who's the best caregiver? All of these things can come up, so that there are family conflicts that occur. All of this, the reason I'm setting all of this up for you is because, given our initial questions for the purpose of the report, the report then came up with some recommendations, and most of the recommendations for interventions and programs have to do with trying to address some of these stresses and strains that I presented in these last two slides. So the recommendations center around how do you reward and look at models that both address what the older adult needs and what the caregiver needs, and to find models that are effective and efficient. Because this is a large problem, you really want models that have been shown to be effective and efficient. You need to have ways of having both public and private partnership that can support research and demonstration programs. So this was another recommendation out of the report, so that we can look at new models of care for both the older adults that can look at prevention, long-term care, palliative care, and you really want to also look for models that can promote the effective use of our workforce, both the informal and the formal workforce, to care for the older adult and to help the caregiver. Finally, a third important recommendation out of this report was that really the healthcare disciplines, the regulators and employers need to understand how to expand the roles of the caregiver and who cares for older adults with these complex needs beyond our traditional scope of practice. How do we teach the providers how to look for and identify caregivers? How do we measure whether or not a caregiver is competent to be a caregiver? And also, how do we have a workforce that feels that they are both professional, have good reimbursements for their time and the responsibilities that are required of the caregivers, both paid and unpaid caregivers? So these recommendations that came out of the report were really, I think, very key ones that allow for us to look at ways of developing models and also promoting models that help with our family caregiving. Next slide, please. So as I read the report, I would say really three things stood out for me as global ways of looking at our caregiving population, and what I think from the report are some key takeaways that would be good for ways to help look for new interventions and new programs, policies, and research. One thing that really stood out, and I think was throughout the entire report that I want to remind us, is that both in all of the recommendations and the findings, that it was very important that we address cultural and ethnic diversity issues. When I use the word family caregiver, it sounds like it's one giant category, but actually within that category we have different styles of caregivers. We have different cultural groups of caregivers. You have caregivers to spouses, which have different needs than caregivers who are adult children, or young caregivers who may be starting their caregiving as early as 16 or so. So each of these caregivers, and as you can kind of see, I put up a nice little puzzle that shows all of the different ways we can look at culture and ethnicity, but we have to look at language and religion, and what are people's experiences, and what are their job levels. For all of these, when we're thinking about our recommendations, and what we might do in planning to help with family caregiving, is I just think that we always have to keep in mind that we want to look at cultural and ethnic differences and that diversity, so that when we're developing or testing or implementing any kind of caregiver support program, this is a common theme that we have to incorporate in our programs. So I just wanted to point that out. And I think that was also, this was taken out of the study, and I was glad that this was really explicitly mentioned in the research report. Next slide, please. The other thing that I thought was very good from the report, they looked at several, they did a very thorough review of all of programs that are out there, and tried to come up with what were some of the common things that are being done, and common themes and key findings from the research that has been done to date, for the last 30 years or so in the area. So when they're looking at the programs and supports for caregivers, one of the key features that came out is that one of the most effective interventions has to start with an assessment of the caregiver's risk, needs, strengths, and preferences. Sometimes we develop programs and with an assumption that all caregivers are starting at an equal footing or an equal level. And I would say when they were looking through the most of the good programs, training programs, skill-based programs, you really do have to start with that assessment of the caregivers, what their risks are, their needs, their strengths, and their preferences. And so a standardized caregiver assessment, there is no one assessment that's being used in any one place, but there are several assessments out there, but they too need some refining and also some more funding, I would say, to keep evaluating these types of assessments. The other thing is, at least from the research review, is that there really are some very good interventions out there, and we're going to talk about that later, that have shown good outcomes when they're combined with the assessment, when they're combined with education and skills training to really help the caregiver improve their confidence. These programs also tend to incorporate some type of counseling, relaxation, and respite training, and they usually also require that there's some kind of active participation of the caregiver in these didactic approaches that make them more effective when presenting programs for family caregivers. So that was one area that they found was important as far as a key finding. We don't have too many randomized controlled trials, but of those where they did use randomized controlled trials, they did find that it can delay institutionalization, reduce rehospitalization, and lead to shorter hospital stays when you do intervene with family caregivers. And so, of course, that speaks to our larger social issue of health care. We are always looking for ways to bend that curve of healthcare costs. Um, Other services and supports, one of the things that they found was still a gap in terms of effectiveness of caregiver services and supports is that we don't have too many interventions that have moved beyond the research phase into like everyday health and social service settings. And part of this has to do with maybe we don't have coverage under reimbursable coverage under Medicare. Um, we don't have many of the smaller organizations. Well, they may not have the resources to help train the staff and maintain these type of programs. Um, some of the programs have been tested may not work in rural areas. And kind of going back to the slide before, many of them have not been tested in diverse communities of caregivers. And so again, that's another reason that we need to continue to look from research and make this into something that is actually implemented in our health and social service um, settings. The next thing I want to talk about, next slide please, is that overall, when they looked at some of the key findings, the areas that seem to be most promising for having very effective ways of helping our caregivers fall into these 7 categories. First of all, education and skills training. Caregivers really need to know more about what are the programs and services and supports out there, but they also need to know very practical things like how do I lift my loved one without hurting my back? How do I lift my loved one without making them fall? Many times, because obviously with the high level of depression that has been found among our caregivers, depression, anxiety, they do need real counseling programs and affordable counseling that focuses around caregiving and counseling, so to have skilled counselors in that area. Certainly respite, which is a way to provide the caregiver with a break both mentally and physically. And some of that may have to do with allowing the caregiver to get away for some time, but sometimes it's also teaching caregivers things like relaxation therapy, learning to do deep breathing, yoga. There are a lot of different respite ways of providing respite and relaxation. Some of it has to do with just having funding to hire someone else to take on some of a few days of work while the caregiver can go and sleep or, read a book or something without having to think about getting back to helping the person. Certainly they need some type of care management directed to the caregiver and not just to the older adult to help them navigate the system. As we pointed out, there are certainly financial strains, so you want to have intervention areas around finances and, of course, around medication and health to help the caregiver both manage medications for the person that they're caring for, because we know medication management is one of those areas that if it goes off, it can cause the older adult who's sick to actually have a worse outcome. But if you can help someone manage those medicines and help the caregiver know how to manage them correctly, again, we can help reduce our healthcare costs. So these have been some of the areas that have been strongly suggested for intervention. And I think that if we can integrate caregivers more into, say, programs like hospital discharge processes, or we can really look at ways of decreasing rehospitalization and actually shorten lengths of stay. And there have been a few studies that have done that, and I think we just need more in that area. So the next slide, I think the other key thing besides diversity that we want to make sure becomes a model that underlies how we look at interventions is having to do with emphasizing person-centered care actually needs to evolve into more of a focus of person and family-centered care. Currently, we hear a lot in our healthcare field about helping the person be the primary decision maker, and that would be the identified patient. But if we evolve our care into bringing and incorporating the person and family, I think that we will have a much stronger um, family systems approach to healthcare, and I think it will actually save us more money in the long run, because we know that families, as our numbers suggest, they are the bedrock and the ones that are helping to maintain our healthcare system. So if we continue just to focus on the person and leave out the family, we are probably, exacerbating our issues with um, family caregiving needs and with healthcare issues. Next slide, please. So I would say, getting close to wrapping up, is that one of the things that that happens with our healthcare field is that many providers aren't identifying the family caregiver. And of course, part of that is not doing an assessment, not asking what their role is and what their competencies are. So we really do have to, and this was also brought out in the report, is that providers have to have skills themselves on how to recognize a caregiver, how to assess whether or not that caregiver can participate in care, and what are the best ways that they can help with the care of the older adult. The providers, who are really the first level people, they need to be able to engage and share information with the caregiver, so they need training themselves. They need to know how to recognize the caregiver's own health and healthcare needs and help support those needs. And if the provider themselves, the physician, or who's maybe working with a care recipient, well, they may not be able to be there to support that caregiver, but they should be able to know how to refer to needed services and support. So part of this awareness is to help also educate the ground level providers, both in the medical field and the social service field, and the more kind of no wrong door, so that everyone becomes a eyes in the community to identify family caregivers, the better I think we'll have in helping to, again, bend that curve in our healthcare field. Next slide, please. So I would say that in almost wrapping up here, that we need to be able to look at where can we go in terms of what do we need for next steps. I think that we do need to have more programs and research, and this came out of the report, that looks at what are the diverse populations of caregivers and their families, so that we have programs that may just focus on the Latino community or the Chinese American community, may focus on adult children or spouses or young caregivers. And I think everyone has a different approach, or you could approach it from the disease level of who the caregiver is caring for, based on is it Alzheimer's disease or Parkinson's, but there are many approaches to looking at the diverse population of caregivers. We certainly need more longitudinal research, um, so that we can follow over time to see, because these are chronic diseases, caregivers are usually there for a long period of time, and we should be able to identify what are going to be the times when they need key supports, and maybe that will help us better refine when we provide interventions in an effective way. Certainly there's geographic diversity, and really if we take an approach of looking at caregiving from a biological, a psychological, social, and a spiritual, because we don't want to forget that we're trying to feed the soul of everyone. So if we have this biopsychosocial spiritual approach in our research, I think will do better in helping caregivers. And then finally, one of the key things that was mentioned is that there's really a large opportunity to use technology, both to help the caregiver in addition to the care receiver. And when we talk about use of technology, some of that are very simple technology things that allow for a caregiver, say, to be able to pull up resources online easier than, just globalized searches. But part of it could be how well having things that allow for them to monitor their own health in relation to how they're working with their family member, technology that allows easier communication with the social network and the medical network that they're working with, technology-based support for education, skills training, things that really help maybe help with having support groups in areas like rural areas where people can't get out of the house but would be able to be online and talk together. So there are a lot of things that we can begin to look at how to use technology and help the caregiver use that technology to make their caregiving experience a little easier. So last slide, please, or next slide. So the next slide, okay, I don't know. We didn't get to the, okay, so the next slide, I just wanted to say that overall, most family caregivers and friends of a patient really have this enormous role in helping care for older adults, and there's really this growing awareness that providing them with better training, the caregiver, and improving their integration into the formal healthcare team really is going to be an asset in our overall healthcare delivery system. If I could get to the next slide, I just wanted to say that generally we want to say that never believe that a few caring people can't change the world, for indeed that's all who ever have. And I think the fact that we're all on this phone today shows that we are that group of caring people. And so I'm going to stop there.
Well, thanks so much, Donna. A great overview of this important work that's brought together basically all the research and other studies that have been done in this field into really a comprehensive report. Before I move on, I want to remind you that we will be having questions and answers at the end of the presentations. So there's a box that you see on the right hand of your screen, and there's a section for questions. If you just open that section, you can type your questions in at any point. I'll be asking those to our panelists in just a few minutes. But now we want to turn to Ronnie Snyder. And Ronnie, the John A. Hartford Foundation provided support for this study and report. And also, the Foundation's been involved in this area of family caregiving for a long time. So could you tell us about how you see this report aiding the Foundation's work, and also how you see other foundations that are involved in aging using this as a way to expand their work on family caregiving?
Absolutely. Thank you, John. And thank you, Donna. That was a great presentation. And I really appreciate your emphasis on cultural and ethnic diversity. So as John's asked, I'm going to speak with you today about why we at the John A. Hartford Foundation are interested, how we're involved, and what we've done, because I really want to talk about opportunities in funding, since this is such a critically important issue. There are 18 million family caregivers of older adults in the U.S. They are largely invisible, and they provide over 80% of the long-term care to folks in our country. So this is really important to us. And next slide, please. I'll give you a little bit of background about the John A. Hartford Foundation. We are a New York City-based national philanthropy with a mission to improve the care of older adults. So since 1982, the foundation has awarded more than $565 million, so more than $500 million in grants specifically to enhance the health and well-being of older people. We have a vision for a nation where all older adults receive high-value, evidence-based health care and are treated with respect and dignity and have their preferences honored. That's really important to us. And next slide, please. we've designated 3 different priority areas, as we call them. They are age-friendly health systems, family caregiving, what we're here to talk about today, and serious illness end-of-life care. You can tell that age-friendly health systems is sort of an overarching, we really operate at the nexus of aging and healthcare systems. So that first bullet is an overarching theme, but we've broken out the next 2 program priority areas because they're so critically important to us. I'll also share that we are guided by the triple aim priorities, and for us those are, we're committed to better care for older adults that drives better health outcomes and lowers overall costs. So I'm going to back up just a little bit and describe what a family caregiver is. Donna rounded some of this out, and I'm just going to add a little bit more to that because we think about this all the time and it's so important. Family caregivers are the people who help parents, spouses, aunts, uncles, and other loved ones to live independently. So they do all kinds of things. They prepare meals, they handle finances, they manage medications, they drive to doctor's appointments and help with things that Donna mentioned like bathing and dressing. And increasingly, they also perform really complex medical tasks and more. And all of that is so that their loved ones can remain at home. We, as a society, have a preference for aging in place. The vast majority of us would prefer to age in place, and family caregivers allow that. So we also believe there's a demographic imperative. The population of older adults is growing, and with it, so is the need for family caregivers. One more point on the demographics, the population segment that's growing the fastest are those who are over 85, and those are the individuals who are most needing to rely on family caregivers. So we view family caregivers as the linchpin of long-term care. Donna mentioned how important they are. I've kind of broken that down a little bit. I think about sort of what is a linchpin. It's something that holds together different parts that exist as part of a unit or function as part of a whole. And whether you're talking about the wheels on an axle or whether you're really talking about a person who holds together the critical elements of another person's life, caregivers hold 2 lives together. They're important in and of themselves, and they're also important for their loved ones. So we really have, they're a twofer. We really have to take care of both. And paying attention to caregivers does that, whereas the flip side, marginalizing them put both the family caregiver and their loved one at risk. Next slide, please. So we were one of the primary funders, as John mentioned, of the study that's called Families Caring for an Aging America. And we intended from the outset to use the findings and the recommendations of the study to guide our grant making in the area of family caregiving. So we were really excited in September when the report did come out. The grant that we made was made jointly to the National Academies of Sciences, Engineering, and Medicine, and with a separate piece to the Gerontological Society of America. And I'll tell you a little bit about that on the next slide. Our overarching takeaway from this report is that care must be not just person-centered, but family-centered. So this next slide really describes the goals of our grants, and the first 2 bullets there talk about the consensus study and the recommendations themselves. Those were the National Academies of Sciences piece. And then the last bullet was what we funded the Gerontological Society of America to do, the dissemination. So just to give you a little bit of a background on what this study was, or is, it's a 22-month consensus study involving a committee of experts in family caregiving and caregiving-related issues in healthcare, long-term care, business, and technology. So lots of folks were brought into this committee. The committee provided recommendations for government and private sector policies and also actions that support family caregiving of older adults. So the recommendations that they came out with are based upon both an in-depth review of available evidence about family caregiving, and Donna spoke to that a bit, as well as information and the viewpoints presented in public sessions by a variety of individuals, older adults, family caregivers, healthcare and social services professionals, as well as employers and technology developers and others. Next slide. So these are the outcomes of that particular grant that we're really excited by. The first is the report itself. It describes existing evidence-based interventions, and it also describes and lays out policy recommendations. The dissemination piece, and this is substantial because this is a very wide distribution of the National Academies of Sciences report. It's broader than most. It included 27,000 copies that were sent of the report itself, an additional 6,900 report views just within the first 20 days, 700 registrants on a follow-up webinar, as well as congressional staff briefings. There were other methods of dissemination in addition. These are the main ones. And this last bullet, later this year, in March, there is a Hill briefing planned to orient the incoming administration. We all know that there are a lot of questions right now and a great deal of uncertainty about the incoming administration, but at least for now there is a Hill briefing being planned to call for a national strategy and to highlight the family as a unit of care. Next slide, please. So what have we done at the John A. Hartford Foundation as a result of the report? We're thinking hard about what we will be doing in terms of our funding, and I'll talk about that in a few more slides. But in the meantime, we started what we're calling a funders collaborative, and that has been a group of private funders who have an interest, any interest, in the area of family caregiving. We've called together folks who may have funded in family caregiving in the past and may have not done any funding whatsoever, but want to share information, want to learn from each other. It's a sort of a safe space just for funders because no one wants to be pitched to while they're still learning and determining what's out there and what might work for their institution back home in terms of potential funding. So the idea is to discuss what's in the works, what's already happened, avoid recreation of the wheel where things have already been done, give each other opportunities to learn from each other because we all have very different reach and different backgrounds and information. And it's also a means where funders are interested to allow for networking and collaboration. So how we've done that, so far we've had a series of relatively regular phone calls, let's say once every 6 weeks or so. We have one scheduled for next week. And we had an individual dinner gathering at the most recent GIA meeting as well in October. So it's open to any private funder who's interested in the area of family caregiving. And I just wanted to give you a couple of examples of the kinds of funders who have participated, because there are some large funders and some national funders like ourselves who have participated. The John A. Hartford Foundation, the Archstone Foundation, which has a long-standing and stated interest in family caregiving, the Research Retirement Funding Foundation, and the Robert Wood Johnson Foundation. But I don't want anyone to feel that they have to be a big or a national foundation. This is open to anyone, and so I've listed some of the state and regional foundations that also have expressed an interest and been on the calls, including the California Healthcare Foundation, the Santa Barbara Foundation, Health Foundation for Western and Central New York, and the Endowment for Health, which is in New Hampshire. So there's really a wide array of folks who have participated and stated some interest in. There's broad sharing. Anyone can share or can just listen depending on interest. Next slide, please. So the rest of my presentation is going to focus on a variety of current and ongoing opportunities. So of those, and they'll be described in the next slides, 2 of them come from what we call the Dementia Caregiving Network. And that is a network that was originally brought together under the John A. Hartford Foundation Change Agents Initiative. It came together in collaboration with the Gerontological Society of America. And it's made up of a group of dedicated, long-standing experts in the field who really wanted to think hard about what's needed in dementia caregiving. And some of them were on the committee for the Family Caregiving Report itself. So these are folks who are really plugged in, know what's needed, have a sense of what kind of work is needed based on the report and beyond. We have 2 different opportunities also from AARP, and AARP is of interest because it has a very broad reach. It's got a 50-state platform and a long-standing stated interest in family caregiving as well. And then I'll also talk a little bit about one opportunity or set of opportunities from the ARCH National Respite Network and Resource Center. they're all detailed on the following slides. So next slide, please. This slide shows a project that we're working on right now together with other funders, the Archstone Foundation as well as the Retirement Research Foundation. So this comes from the Dementia Caregiving Network that I just mentioned, and it's a project to develop what's being called an online resource for comparing evidence-based dementia and caregiving programs. I'm going to give you a little bit of background about this. There are, and Donna made reference to this, there are existing evidence-based programs that have been developed to support families who are caring for older adults with dementia and to reduce the adverse effects on patients and on caregivers. There are about 50 of those programs actually, but they're not really very well known and they're not widespread in use. People just don't really know about them. So according to the report that we're referencing, Families Caring for an Aging America, most healthcare and social services organizations haven't incorporated these programs, and therefore most family caregivers are not able to access the programs despite proven benefits. So one of the significant barriers to the adoption of these programs being offered is the lack of a single source of comparative information. Things like comparing program characteristics, comparing the workforce that might be needed, the costs of implementing a program, and the outcomes of a program. So without that kind of information, healthcare and social services organizations have a lot of difficulty determining which program works best for their organization or organizations. So this is a project that's in partnership with the Benjamin Rose Institute on Aging, as well as the Family Caregiver Alliance. And the online resource that we're currently developing and hoping to bring to our board at our next board meeting will provide health and social services organizations, independent service providers, as well as government and private sector funders with information to help them to decide which dementia caregiving programs might be most appropriate to add to their existing service offerings or to financially support. I want to make two last points on this slide. First, this is a project that is, again, intentionally in keeping with the recommendations of the National Academy of Sciences study. And second, this is a group that is really interested in going beyond dementia programs. So that's where there are additional funding opportunities. It's outside the scope of the work that we're currently developing, but it's an opportunity for other funders who might be interested in considering ways to share information about other programs beyond dementia support that would support family caregivers. Next slide, please. This is also a project coming from the Dementia Caregiving Network, and it's seeking to add family caregiver representation into the electronic health record. So when a patient has dementia, it is usually the caregivers, right, not the patients who make things happen. They're the ones who ensure that medicine is administered. They are the ones who schedule doctor's appointments and keep them, as well as being the ones who are there for care transitions. So really, these are cases where the patient cannot be separated from the caregiver in terms of their care. So the impetus for this project comes from two different things. First, the report calls for a viable mechanism in the health record for identifying caregivers in order to optimize the part that caregivers play in the health care of their loved ones. And second, the Dementia Caregiving Network led a survey of patients, caregivers, and professionals who are working on issues related to aging and dementia, and 95% of those strongly indicated the importance of having a doctor or medical staff member know the caregiver's name and have their contact information. So work to date on this project, this is a little less developed than the one I described previously, but they're defining strategies for caregiver representation in EPIC, which is a particular electronic health record that is in widespread use across the country. And they're doing this in partnership with Baylor Scott and White Health, which is in Dallas, Texas. So you can see the critical characteristics that are included: family caregiver contact information being clearly visible to clinicians, information reported by the family caregiver should be clearly visible to clinicians as well during healthcare encounters. Information needs to be located in a structured field so that it's reportable and so that it can be found easily. And schedulers and providers need to be able to enter and edit information about the family caregiver as healthcare evolves. So they're trying to advance three objectives. Broadly, what they want to do is conduct an environmental scan of what's currently known regarding the engagement of family caregivers in health information technology. They also, specific to this site, because this is just a starting point, want to review the ongoing EPIC enhancements that inform the goal of family caregiver representation in the electronic health records. And then they want to develop an action plan to really move this forward for broader representation within electronic health records. So ultimately, the goal here is to set a model for including family caregivers into those electronic health records as a meaningful way of ensuring that those family caregivers are recognized and incorporated into their loved one's care. Next slide, please. So these next two slides, as I mentioned, will reference work that's being led by the AARP Public Policy Institute. And the first is on the CARE Act implementation. I'll give you a little bit of background on what the CARE Act is. This is an act that's effective right now in 35 states that supports family caregivers when their loved ones go to the hospital. And it's really designed to help them to safely provide care when their loved one is discharged home. So there are three important features. First, the name of the family caregiver needs to be recorded when a loved one's admitted into the hospital or a rehabilitation facility. Second, the family caregiver needs to be notified if that loved one is to be discharged to another facility or back to home. And third, the hospital or rehabilitation facility has to provide an explanation and live instruction of the medical tasks. So things like medication management, injections, wound care, and transfers, things like that, that the family caregiver is being asked to perform at home. They need that training. So you can see what they've done so far. There's been a stakeholder meeting. Site visits are currently underway to understand the implementation process of these CARE Act requirements and to look at individual hospitals. So their goal is to complete a scan of 10 to 12 different states by the end of this year. And this represents really one opportunity to work with AARP because they have a great reach. They could work nationally, but they also work within individual states to help determine and spread possible best practices. Next slide, please. This is a slide about the AARP convening of a Home Alone Alliance in response to a report funded by the John A. Hartford Foundation called Home Alone: Family Caregivers Providing Complex Chronic Care. So here's what we know. As older adults are discharged earlier from hospitals to home, today's family caregivers are expected to perform really complex medical tasks that were previously provided by trained healthcare professionals. So unfortunately, family caregivers don't often receive the assistance that they need to perform those tasks. And what that does is to leave family caregivers to perform these really complex medical and nursing tasks with very little guidance. That adds to their feelings of stress and their concern about making mistakes. So AARP is bringing together key partners from a variety of sources, from public, private, and nonprofit sectors, in order to change the way that healthcare organizations and professionals interface with those family caregivers. So you can see the pictorial here. As it's designed, they want to position AARP as a hub of research, outreach, convenings, and resource development. So some of their current activities are listed here, and they're interested in partnering with others. So this is another great dissemination platform that can operate either nationally or locally. Next slide, please. So this really responds more to research and less to practice, but Donna mentioned a number of research needs and opportunities, and this is a real opportunity. The ARCH National Respite Network and Resource Center has had support from the U.S. Administration for Community Living, and they have housed a Lifespan Respite Technical Assistance Center as a result of that. They recently concluded a 2-year process in which a national and interdisciplinary expert panel on respite research reviewed all of the existing literature to identify various research gaps, to address the methodological concerns, and then develop a framework for future research in the field of respite care. So this was funded on the basis that a stronger evidence base for respite would help protect respite availability and also improve both access to and quality of this service that we know is so critically important. So funding opportunities here involve research grants from small to large, from small and local even things like a local dissertation research grant, to much larger randomized and controlled trials. There's a lot of need and a lot of opportunity here. Next slide, please. So I want to thank you. I will be happy to connect listeners to the people working on any of the projects that I mentioned as funding opportunities. And thank you, John, for having me. I'll hand it back to you.
Well, thanks so much, Ronnie. We have a few questions, but I think at this point I would like to turn back to you because we had such great content today. Remind people that on your screen right now are the contact information for our two speakers, and it may be easiest to follow up with them directly. But let me turn back to both of you individually and see what your final words of wisdom would be for our audience. What would you like for everyone to remember? So Donna, let's start with you. She may have put herself on mute. So Ronnie, how about you?
You bet. So I'm really excited to be a part of this today. And oh, there she is.
I'm here.
There she is.
All right. So our provost at USC might label caregiving as an invisible, wicked problem because it's a problem that in its very nature is resistant to resolution. So it's an issue that's complex. It requires solutions that come from multiple disciplines and communities. So I would say to sum up my thoughts on this issue, it reminds me of an East Indian fable of the blind man and the elephant. And that's the story of 6 blind travelers who come across different parts of an elephant in their life journey. In turn, each blind person really creates their own vision of reality from that limited experience and perspective. And I would say the report we discussed today really presents us with several perspectives and options. And I think now each of us has the opportunity really to make this elephant that we call caregiving visible so that all of us can really admire its beauty and strength.
Well, thank you so much, Donna. Ronnie?
Thanks, Donna. That was great. I would say I'm really pleased to be on this call, on this webinar, because it's so important to us to share with the broader world what we think is really a critical need and to see what we can do to bring folks together, to work on this together. I think that there are a variety of needs for family caregivers, and those include support. We've talked a little bit about that today, respite and adult daycare and things like that. Training for the caregiver, but also for clinicians and service providers so they know how to meet the needs of caregivers. A role, they need to be incorporated into the delivery of healthcare. And then lastly, they really need access to high quality programs to support them and their needs. The last piece I would say overall is that we're stronger together. So I'm pleased that there are so many other people on this webinar interested and would be happy to speak with anyone individually or hear from you offline.
Well, thank you so much. I want to thank Dr. Donna Benton, the Director of the University of Southern California Family Caregiver Support Center, and Ronnie Snyder, the Program Director at the John A. Hartford Foundation, for their participation in today's program. We thank you for all that you do to make life better for older adults. We also want to thank the John A. Hartford Foundation, Archstone Foundation, and Grantmakers in Health for their support of this program. We will be making this presentation available to anyone who wishes to view it later, including both the slides and audio. Just watch for the rebroadcast link on our website or contact Grantmakers in Aging at info@giaging.org. And also please join us for our next webinar, Purposeful Aging, a New Model for a New Life course, on Monday, March the 6th. More information and a link on the registration will be available on our website, giaging.org. And finally, I want to thank all of you for participating in today's webinar. Have a great day.